Lyme disease. It starts with a tiny tick and can spiral into months, sometimes years of confusing symptoms. But how do we test for it? And more importantly, how do we interpret the results? Hey everyone, welcome back to the channel. Today we're diving into one of the most misunderstood areas of infectious disease medicine, Lyme disease testing. Whether you're a med student, healthcare provider, or just trying to make sense of your lab results, this video is for you. Lyme disease is caused by the spirochete Borrelia burgdorferi, transmitted through the bite of a black-legged tick, Ixodes scapularis. It's common in the northeastern, mid-Atlantic, and north-central U.S., but can pop up elsewhere too. Symptoms evolve over time, from that classic bullseye rash to joint pain, facial palsy, and even chronic arthritis. So where does testing come in? The CDC recommends a two-tiered approach. First, an EIA or ELISA to screen, and if that's positive or borderline, we confirm it with a Western blot. EIA followed by IG Western blots. Sounds simple, right? Not so fast. In early Lyme, especially the first couple weeks, your body might not have produced enough antibodies yet. That means your test could be negative even if you're infected. That's why if you see the erythema migrans rash, you don't wait for labs. Treat empirically. Here's where it gets tricky. IgM is useful only within the first month of symptoms. Rely on IgG. For a positive IgM, you need 2 of 3 bands. For IgG, 5 of 10 bands. Anything less, it's not diagnostic. In 2019, the CDC approved a newer approach, modified two-tier testing, or MTTT, where you use 2 different EIAs, no Western blot needed. This method is faster, with fewer false positives, and it's just as reliable. PCR can detect the actual DNA of the bacteria, but only in synovial fluid or spinal fluid, not in blood. And even then, a negative result doesn't rule Lyme out. Let's bust a myth. Positive antibodies don't mean you have active Lyme disease. They can stick around for years after treatment. Also, lots of things can cause false positives, like Epstein-Barr virus, lupus, and syphilis. That's why context is everything. If someone doesn't have symptoms, don't test them. And if they had a tick bite but feel fine, still no testing, it just causes confusion. To wrap up, 1. Use two-tier testing, either classic or modified. 2. Timing is everything. Don't trust IgM after 30 days. 3. Positive test doesn't equal active disease. 4. Test the right fluids for the right reasons. If this helped clarify things, make sure to give it a thumbs up, subscribe for more breakdowns like this, and drop your questions in the comments. I'd love to hear your thoughts. Thanks for watching. Stay informed. Stay curious.